Hi, my name is Kate Smith. Thank you for joining the 7th episode of Planned Parenthood Presents The State of Abortion. This week, we're continuing to document the impact of the Supreme Court overturning Roe v. Wade, with on-the-ground reports of the latest state laws and legal fights. I'm here to keep you informed so you can decide for yourself. It's been a little more than 2 months since the Supreme Court's decision to overturn Roe, but patients in many states have been living in a post-Roe world for even longer. Thursday marked 1 year since Texas implemented Senate Bill 8, a 6-week abortion ban, and new data from Planned Parenthood confirms what we already knew. Abortion bans don't stop patients from seeking abortion services, they only make care harder to access. From when the Texas ban was implemented in September 2021 through June 2022, Planned Parenthood health centers in surrounding states saw a 550% spike in patients from Texas compared to the previous year. In Kansas, Planned Parenthood health centers saw 400 abortion patients from Texas in that time frame. That's up from less than 10 the year prior. And data from Colorado, New Mexico, and Oklahoma during those same time frames tell a similar story. In Colorado, Planned Parenthood health centers reported 10 times the number of Texas abortion patients. And in New Mexico, Texans accounted for 41% of abortion patients at Planned Parenthood health centers, up from 19%. For the bulk of when this data was collected, Texas was the only state to have a 6-week abortion ban in place, and at the time, it was the strictest in the nation. But as of Wednesday, 16 states had abortion bans in place, and 11, including Texas, have outlawed it at all stages of pregnancy, meaning that those out-of-state patient numbers, they're only poised to get even higher. Last week, we told you how Oregon is preparing for that reality, especially in the wake of Idaho's total abortion ban. But California is also moving to try and help those patients as well. Last week, Governor Gavin Newsom and legislative leaders introduced an amendment to the state budget that would allow out-of-state abortion patients to access a pool of $20 million to assist in their travel costs. State lawmakers are scheduled to vote on the amendment very soon. On Tuesday evening, the South Carolina House advanced a near-total abortion ban. Mason Hickman, a digital state campaign manager at Planned Parenthood Action Fund, was on the ground and can explain.
At first, the South Carolina House actually failed to advance its total abortion ban, voting 47 to 55 on House Bill 5399, which would have banned abortion at all stages of pregnancy without any exceptions for situations of rape or incest. After that unsuccessful vote, anti-abortion rights lawmakers literally refused to adjourn, instead forcing an amendment to the legislation, allowing patients to seek an abortion in the first 12 weeks if the pregnancy was the result of rape or incest. Now, around 2 hours after that first unsuccessful vote, 20 lawmakers flipped their position, advancing the amended bill out of the House in a 67 to 38 voice vote.
The legislation now heads to the South Carolina Senate, who we expect will begin debate after Labor Day. And a new legal challenge this week. On Tuesday, a group of abortion rights groups and providers filed a lawsuit against Indiana's Senate Bill 1. The state's recently passed near-total abortion ban on the grounds that it violates the state constitution. As it stands, Senate Bill 1 is scheduled to go into effect later this month. After Indiana passed its ban, several companies headquartered in the state spoke out against the law, saying they anticipated it would impact talent acquisition and employee retention. We've spoken extensively on this program about the devastating public health consequences of abortion bans, but this week we explored the economic and business impacts of these laws. Melissa Hobley, Tinder's global chief marketing officer, spoke with us about why Tinder's been vocal on this issue and what the impact of abortion bans could be for future generations of workers.
It is a very big topic of conversation in corporate America. We cannot even fully quantify how significant these new laws are going to be. What I share with colleagues and friends of mine at other businesses, especially the executives, is there's a business case for taking a stand on social and political issues. There is a business case for speaking on Roe.
I know we often talk about Roe in the context of a public health crisis, but can you contextualize how much of a setback this decision was for gender equality in the workplace?
It's not 2 steps forward, 1 step back. It's like you took 2 steps forward and then there was a sinkhole, and the sinkhole then turned into the bottom of a volcano.
For more of that interview, as well as updates on all the legislation and litigation we told you about today, head to stateofabortion.org. We'll be taking some time off, but be sure to come back in a few weeks for a very special final episode of State of Abortion. See you soon.